The following video presents a detailed explanation of 3 spinal conditions that cause most chronic pains that facilitate visits to the hospitals. It contains clear images that show the nature of these spinal problems for better understanding. These conditions will be presented to you one after the other with detailed description. The first condition is disc degeneration. This is a normal part of aging process and many other risk factors. Degeneration of the disc is a gradual wear and tear of the articular cartilage that is found between the vertebrae. This articular cartilage provides cushion and serves as a shock absorber, primarily preventing two vertebral bodies from kissing each other. However, as one ages, the strength and function of many systems goes down, and the intervertebral disc goes through wear and tear to become thinner and thinner, which may cause two vertebral bones to start kissing each other, triggering inflammation, which can cause most common problems like chronic pain. Disc degeneration is one of the main problems that cause most low back pains and can be identified under X-ray. This condition can cause chronic pains because as the articular cartilage is worn out, the body naturally finds a way of replacing it, and this process triggers a lot of unusual changes that could cause pains. There can be extra growth of small bones, medically termed osteophytes, which can pinch nerves. The worn-out cartilage also reduces spinal height, and this also reduces spinal foramen, leading to nerve compression. It causes several uncomfortable symptoms like burning sensations, numbness, tingling sensation that could either be localized or radiate through your limbs. Furthermore, as pain remains commonest symptom following disc degeneration, this can create a vicious cycle which can later result to innumerable physical problems, such as causing weakness in nearby muscles, muscle spasms, spinal deformities like scoliosis, and many others. This is why treatment of cases like low back pains does not only focus on pain management, but rather involving other protocols that will improve muscular strength for more stability. As aging remains the commonest etiology for disc degeneration, specific risk factors may also pose an individual's chances higher for this problem. This will include obesity, trauma, one's occupation, and some spinal conditions. The second spinal condition which also mainly affects the disc is disc herniation, another spinal problem whose cause is backed with controversies. Doctors cannot clearly establish why disc herniation occurs. However, this is another cause of many chronic pains. Disc herniation is different from degenerative arthritis of the spine, which has been earlier described. In disc herniation, the articular cartilage herniates, thus the content of the tissue is exposed through crack in the spine. In disc herniation, the jelly-like substance of the disc is mainly the main substance which herniates via cracks. As this occurs, there is a possibility of causing nerve root entrapment or compression, and it can also assume the spaces that accommodate spinal nerves, otherwise known as spinal foramen or spinal canal. This is another major reason to most low back pains. The problem can be shown more clearly under MRI or CT scans. Disc herniation can also be referred to as slipped disc or ruptured disc. The last and third disc problem is disc bulging. Disc bulging is another disc problem that also remains another factor for most chronic pains. It is a problem which precedes disc herniation. In disc bulging, the disc sags and looks like it is bulging outward. The disc goes through aneurysm, and further rupture of the swelling will result to disc herniation. This is why disc bulging is known to precede disc herniation. It usually affects multiple discs, It develops over time and can similarly cause other disc degeneration related issues like spinal stenosis. In disc bulging, the nucleus doesn't push out of the annulus, but the disc simply bulges out of the space it occupies in the spine. In conclusion, there is certainly a mass that anywhere in the spine each of these spinal problems will occur. The resultant feature will include, but not limited to, pain. Other related symptoms can involve numbness, tingling sensation, burning sensation, muscle weakness, and more. These symptoms can either be localized or radicular. There is a clear establishment that each of these can cause nerve root compression, resulting to the feeling of most of these symptoms. Even though surgery can be best option for most of these cases, physiotherapy remains another effective approach to the management of later symptoms caused by these problems. You might not know the cause of your pains in your back until you seek for medical intervention for proper examination to arrive at real diagnosis for better treatment. Thanks for watching. Kindly subscribe if you are a new member, and also personalize your notification to this channel. Like this video and comment.